Global vaccination efforts are underway to prevent people from getting and spreading COVID-19. The World Health Organization has sent officials to call for collective commitment so that within the next 100 days, vaccination for health workers and those at high risk in all countries is in process. But concerns over the pace of distribution, access and efficacy persist. What do you need to know now? And what will be the most pressing issues as vaccination efforts unfold around the world? Joining me today are Eric Ding, a senior fellow at the Federation of American Scientists via Skype from DC, and in Shanghai, Chen from East China Normal University. Gentlemen, welcome to the show. So the World Health Organization has said that they would like to see vaccination programs underway in every country in the world within the next 100 days, with the frontline health workers and high-risk groups prioritized. Eric, how realistic is this plan? What is the consideration behind such a timeline, according to you? What do you think of it?
Right. I think it's a good plan. The issue is the begin to is the key word. Many countries under COVAX will only get a small allotment from COVAX for their total population needs. And currently, I think many countries are scheduled to receive only about 20% of their country's entire population in March, beginning March. So I don't see they can roll it out beyond just their limited healthcare workers and the elderly population. Beyond that, most of these COVAX countries do not have supply for the rest of their population as of yet.
Yeah. Well, let's talk a little bit about the differences between the various kinds of vaccines that are out there. We understand that at least there are many different kinds, right? 50 different vaccine candidates in trials, according to the WHO, and in the United States, in the UK, in China, in Russia, we all have different vaccines. So in terms of and in China, we have Sinovac, Sinopharm, and CanSino, at least the three that are out there. What do you think, from what you've heard, what is distinct about the Chinese vaccines compared to the international ones? And how does the Chinese vaccines work, according to your knowledge?
Right, so the Chinese vaccines are mostly inactivated vaccines. It's the classic vaccine type in which they take the virus and then they make sure they neutralize it in a certain way so that it can't actually infect people. But it trains people when vaccines are training programs, are the entire virus. Well, most of the other ones are spike protein targeted. The Moderna, Pfizer ones are mRNA that synthesizes just the spike protein. So it trains people to recognize the spike, as well as the adenovirus of the Oxford AstraZeneca and the Sputnik are also adenoviruses, which are DNA viruses, again, to train the spike protein of the virus. And same with Norovax, which is a protein directly of the spike. But the Chinese ones are the inactive virus, so it trains you on the more diversity of it. That said, it's less targeted for the most relevant key part of the spike protein. And we've seen that the Chinese efficacy ranges around 70 to 80%, although some trials in Brazil show lower. I think it's a very different one, and it's also much cheaper than the mRNA vaccines.
So pros and cons on either side, right? In terms of the effectiveness, in terms of protecting the people, how can people make the choice? I mean, we have seen at least 20 countries purchasing vaccines developed by China, but obviously there are many other countries who are administering other types of vaccines. Is there a major difference in terms of safety, effectiveness, or it's really a matter of choice? Eric?
Well, safety are still, the safety right now, the vaccines all are relatively safe, other than just some mild fever and soreness or fatigue the first day. The cost, of course, some of the costs are 10x less than some of the other vaccines. And I think right now, take whatever vaccines you can get your hand on. We do not have the luxury of choice throughout the world right now. And they all work because whether it's 70, 80%, that is better than zero. That is infinitely better than zero. So I would say right now the choice is get whatever you can get your hands and supply on.
All right.
And of course, with the study.
Yeah. Professor Chen, let me bring you in. How do you look at the very uneven picture we're looking at this moment in terms of progress of rolling out vaccine programs? In some countries, it's way more ahead. In some countries, just barely starting. Some countries have stocked, for a few times the vaccines necessary for their population, while other countries might have just only a fraction for their population.
Yes, I think that actually this is actually a problem we need to face up to. That is actually the inequality of the distribution of the vaccine. China actually has always been, stressing upon the importance of the vaccine being a global public good. But for some other countries, especially countries in the West, actually those countries have been, talking about a kind of like a vaccine nationalism, a kind of, monopoly of the resources of the vaccines. So trying to stockpile the resources of the vaccine for their own use. But that is definitely not actually good, because as we always have been saying, that vaccine, the virus, respects no borders. Actually, you cannot simply, trying to, safeguard your own country without, paying respect to other countries. So in this regard, actually, vaccination should be actually taking place globally, as we have been discussing. The WHO been talking about a global rollout of the vaccination globally within 100 days. That is a very important target. That's actually to ensure the global even distribution and accessibility of the vaccines.
That's why the multilateral institutions are very important in times of like this. Eric, I have about 5 minutes, and I really want to get across as many technical questions as possible, because a lot of confusion out there. For instance, in terms of safety, right? We've all seen the cases of people who have died, who are extremely frail and old, who have died within days after getting vaccine in Northern Europe. Of course, in Norway, in Norwegian Medicine Agency said in the statement last week that they cannot rule out it's from the adverse reactions, but at this moment it seems that there is no stopping, there is no pause to think. So exactly, is it safe for people aged over 80 to receive the vaccines? What should they do?
So we had trials, and they had included people of that age group, and we saw no elevated risk. Now, I would say this: if this is true, that there is this increase among those over the age of 80 in Norway, we should see it in also retirement homes in Sweden, in UK, in the US, but we're not seeing those right now. So it's a very funny kind of situation. We're not sure if it's related, because if it's related, we should see it in all countries.
But should people be taking precaution at this moment then? Should people take a pause and say, okay, for those aged over 80 and above, let's wait for a moment? Should we do that?
So I think we have taken a pause for those with allergies. They say those with severe allergic reactions don't take the vaccine just yet, or make sure you have an EpiPen ready. We've paused that. But I think the regulators are looking over the data. And the case reports right now, it's not enough to have it just in one country, because this is not a country-specific phenomena. It should be seen in other countries worldwide if it's true. And I don't want to also scaremonger and make other people fear the vaccine whenever we don't have evidence. Case reports, here's the truth. Here's a natural truth. When you vaccinate 10 million, 100 million people, you're going to have people who naturally die. And we want to see if it's truly related to vaccine before we halt the vaccinations over the 80, especially when we're most vulnerable.
So at this moment, it is not advised that older people, for instance, those aged over 80, do not get vaccinated. Is that what you're saying? How about those who are young, under 18? Should they be, allowed to go ahead and receive vaccines, whether Chinese or foreign?
Well, so the Moderna vaccines are approved for 16 or older. The trials that we did were not in children yet. That said, I think one of the Chinese Sino groups, they're actually saying they're going to finish their pediatric trials. It's more of a dosing. How much of a dose should children get compared to adults? Okay. That the pediatric dose trials will finish by March, and we will have a definitive answer by then.
Yeah. What if you're not sure whether you have COVID or not, or you have very mild symptoms? Should you still go ahead and get a vaccine?
Yes, still get a vaccine. Even if you definitely had COVID, still get a vaccine. Because what we know from the phase 1 and phase 2 trials is the vaccine offers stronger and robust immunity than convalescent patients, just people who have previously had it. Because the vaccine trains you into a much targeted nature of the spike protein, which is much critical for binding human. So this is why please take the vaccine even if you've had it before, because the vaccine gives you stronger and longer robust immunity, especially with 2 doses.
Well, for those, last question to you, Eric, for those who say that they don't trust the absolute safety of vaccine, they will take, you know, their own life in their own hands, and they don't want anybody to give them either mask or vaccine. What are you going to say?
Well, I would say, like, what do you value? Do you value your family? Is it just a choice about yourself? Do you want your children to go back to schools? Because at the end of the day, we want our children back in schools. You can try to decide for your own risk. At the end of the day, you're endangering others around you, and that is irresponsible.
Okay.
And the total net benefits outweigh any perceived risk that you have for yourself. So think of the community, not just yourself.
Yeah. Professor Chen, 30 seconds, please, if you can. What do you think has been standing in the way of the global collaboration and shared responsibility by everybody, not just country, but citizens, to fight against the COVID-19?
I think I should be straight talking about the geopolitical prioritization in some countries that actually to politicize and weaponize the use of the vaccine, in a number of countries. That actually is quite alarming, for some countries, deliberately trying to belittle, for example, the Chinese developed vaccines and deliberately trying to cover up some kind of the drawbacks of the Western, vaccines, even in spite of the fact that there are some evidence, indicating an alarming trend of some kind of potential dangers. And I think this is actually the obstacles and dangers we have to face up to.
All right, we're going to leave it there. Many thanks to Eric Ding joining us from the United States and Chen Hong joining us from Shanghai.